Well, the evening medical bulletin for the state of Karnataka is out. Let's take a look at some statistics and some big news that's just coming in. Number of COVID-19 positive cases in Karnataka has risen to 279 right now. COVID-19 has claimed 12 lives in the state so far. 80 people have been discharged. 19 new COVID-19 cases reported today, the single largest so far up until this point in time. We were speaking about how the number of cases was at 277 in the previous medical bulletin and the deaths at 11, and in the latest medical bulletin we are given to understand that it is 279 positive cases and 12 deaths, and 80 people have been discharged so far. This means that a total of 19 cases related to COVID-19 have been reported in just one day. Well, the number of positive cases across the state is only on the rise, and with 19 new cases coming to fore in just about today, it is the single largest number of positive cases that have surfaced in the state of Karnataka, and this comes at a time when lockdown 2.0 has just begun. So far, 80 people have been discharged and 12 people have lost their lives. Now, out of the new cases that have been reported, most of them are from Mysuru, the jubilant pharmaceutical company operating out of Nanjangud. At least about 10 of them seem to be from Mysuru itself. But yes, we will get more details to you in just a moment. But we're speaking about how the latest medical bulletin has been released by the government of Karnataka, and the number of positive cases has only risen this time around to 279 from 277 that was reported in the earlier medical bulletin, while the number of deaths has gone to 12. For more on this, I'm being joined in by my colleague Amrita once again. Amrita, the numbers have only increased from the last medical bulletin, 279 positive cases, 12 deaths and 80 people discharged. But what really stands out is that 19 new cases have been reported in just a day. What more details do you have for us?
Adarsh, this is the latest, daily high number of cases which have been registered in Karnataka. That is 19 number of COVID-19 cases. But that being said, we've also had one more death today coming in. That makes it 2 deaths reported in one day. So the latest death is patient number 279, who is a 80-year-old lady, resident of Belagavi, who has recently expired. Now she has a contact history with patient number 224. So we'll bring you more details about who the patient number 224 is and what kind of travel history or any other contact history this person has. But that being said, going over the entire health bulletin which has been released today, there are 19 cases, of which patient number 261, a 59-year-old male who is right now isolated here in Bengaluru city, has once again been categorized under severe acute respiratory infection. So when it comes to the SARI cases, there are 2 SARI cases as of today, and also one which has been categorized under influenza-like illness. So basically there are 3 mysterious COVID-19 cases which have come to light as of today. We can say the one is from Bengaluru city, who is a 59-year-old male. The other one is a 72-year-old male from Mysuru. And then there is one-year-old child from Kalaburgi who has tested positive after showing symptoms of influenza-like illness. So the health department is yet to clarify about what are these SARI cases and what are these influenza-like illness which have been coming to light. When it comes to the influenza-like illness, we need to take note that this is the very first case which has come to the light wherein a person has been categorized under influenza-like illness. But that being said, there are several cases which has come to light from Mysuru. Almost all of them are, one or the other way linked to Nanjangud in Mysuru. So we have on our screens the patient details. Patient number 261, who is a 59-year-old male admitted here in Bengaluru urban. He is a resident of Anantpur and has been categorized under SARI case. Now, these are some of the details which have been coming to light in the medical bulletin, Adarsh. So that takes the active number of cases in Bengaluru city to 34 and 2 deaths reported. And moving on, patient number 262, who is a 52-year-old male from Bagalkot, has a contact history with patient number 186. And another thing that needs to be noted down, which is quite distinct in this medical bulletin, is patient number 263, who happens to be a 39-year-old male from Jamkandi in Bagalkot, isolated in Bagalkot itself, who was a police on duty at a madrasa in Mudhol of Bagalkot. Now, this is quite interesting. He does not have any such contact history given over here, nor any travel history, but he is an essential service provider, a police on duty who was outside a madrasa. So this particular madrasa, where outside which the police was on duty, might also be a sensitive zone right now, and the officials are already scanning the area and bringing out, taking out more details about how this particular police on duty got infected with COVID-19 while on duty outside the madrasa. It might be possible that the entire area, not just a madrasa itself, might be the emerging hotspot of COVID-19 in Bagalkot. But that being said, patient number 264 is a 41-year-old male from Nanjangud, Mysuru, again a pharma company worker. There are several more pharma company workers who have tested positive today. That is patient number 265, who is a 30-year-old male. Patient number 266, 27-year-old male. Patient number 267, 35-year-old male. Patient number 268, 26-year-old male. Patient number 269, who is a 23-year-old male. Once again, patient number 270, 35-year-old male. Patient number 271, 28-year-old male. And patient number 272, again 32-year-old male. And patient number 273, 72-year-old male from Mysuru. So these were some of the people who were working at the pharmaceutical company in Nanjangud of Mysuru who have tested positive. But when it comes to patient number 273, Adarsh, who is a 72-year-old male in Mysuru, he has been categorized under a severe acute respiratory infection. He is not a worker of the pharmaceutical company. So other than that, Kalburgi again has one more case of COVID-19, who is a 1-year-old child categorized under influenza-like illness. Other than that, Vijayapura has 3 new cases of COVID-19, all of whom are the contact of patient number 221. So patient number 275, who is a 38-year-old female from Vijayapura, came in contact with patient number 221. Same as well for patient number 276, who is a 25-year-old male from Vijayapura, again came in contact with patient number 221. And we have one more case coming in from Bengaluru urban, which is patient number 277, 32-year-old female, who came in contact with patient number 252. And finally, we have one case coming in from Belgavi, that is patient number 279, 80 years old female, came in contact with patient number 224 and has expired at the designated hospital in Belgavi. So these are the latest details, Adarsh, which has come to light today. And moreover, the concerning matters in this particular bulletin are the SARI cases and influenza-like illness, and also the number of cases coming in from the pharmaceutical company, which has now turned out to be the latest hotspot in Mysuru.
Many thanks, Samrita, for joining us with those inputs. Right now, we are showing you as to how the contact history really is panning out across all of the patients that we have spoken about up until now. It's all Nanjangud that really hogs the limelight, given the way in which the number of cases is only increasing. It all started with that one pharma worker who, in a sense, went ahead and got in touch with so many of his employees, right from patient number 264 to patient number 272. Today, at least when it comes to 9 patients, almost 9 patients out of the total patients coming in from Mysuru had come in touch with that pharmaceutical worker from Jubilant Pharma Company. Patient number 269 as well, 70, 270, 271, 272, all of them had come in touch with the pharmaceutical company worker. Well, when it comes to 273 though, it is slightly different. It is related to severe acute respiratory illness, while 274 is influenza-like illness. But how unfortunate is it? We're talking about a 1-year-old who's lost his life from Kalaburgi. When it comes to patient number 275, we're talking about a female from Vijaypura who came in contact with patient number 221, while patient number 276 also came in contact with the same patient number 221, that is, and patient number 277 from Bengaluru urban had come in contact with patient number 252. So this is, again, we're talking about how patient number 278 also got infected due to patient number 221. So we're talking about at least 3 patients in the day coming in from Vijaypura, all because of one patient, that is 221. Now, patient number 279, on the other hand, had come in contact with patient number 224. So that's the history, the travel history, the contact history of the latest patients that have joined the list up until 279. But again, what really hogs the limelight, the way in which the number of cases have only spiraled out of control when it comes to the pharmaceutical company, the Jubilant Pharma company in Nanjangud. When it comes to the pharma company, you're talking about how one patient in fact went ahead and infected so many patients, patient 264, 265, 266, 267 as well, 268 and 269, 270, 271, 272. All of them happen to be employees of the Jubilant Pharma company, and all of this has happened because of just one worker. In the beginning, as we had reported, we've been constantly telling you as to how the number of positive cases have only gone up almost on a daily basis. And just in the last one day, we've reported as many as 9 positive cases coming in from the Jubilant Pharma company out of the 11 odd positive cases that have been reported from Mysuru. So this is the prime example of what a hotspot is. Amrita, coming back to you on the way in which the numbers are really escalating, the way the numbers are surging when it comes to the Jubilant Pharmaceutical company. What can be really done on the ground? You have the entire Nanjangud really sealed down in a sense, but how best would the authorities be able to go ahead and tackle this situation?
Here is that while there are more than at least 30 employees of this particular pharmaceutical company testing positive for COVID-19 and further on infecting several others, taking all of those COVID-19 patients linked to Nanjangud, about 50 people have now tested positive for COVID-19. What is more shocking is that so far the district administration over there hasn't taken any concrete stand about the factory itself shutting down or not. Now the new district in charge minister S.T. Somshekhar has come out and said that this particular factory, pharmaceutical factory in Nanjangud, will remain shut for the time being because it has now become a cluster of COVID-19 cases in Mysuru city. So this comes after quite a bit of time, only after 9 cases from this pharmaceutical company emerged today. But before that as well, we've had several more cases of COVID-19 just coming in from this particular factory, and furthermore the employees who are being detected for COVID-19, they're on going and infecting several other family members, their friends and everybody else outside of this particular cluster. So it has become a huge headache, but so far nobody really knows how exactly an employee, the patient number 52 at Nanjangud Pharmaceutical Company, who worked as a quality check manager, contracted COVID-19 in the first place. So that still remains a mystery. Meanwhile, while the entire factory should have been shut down back when the very first employee of this company had tested positive for COVID-19, that did not happen. Even when it was unknown how exactly he contracted the virus, the company was not shut down, and several more workers continued to pour in for work, and that's how the situation seems to have now already gotten out of control. But what the district administration, even the medical education minister Dr. K. Sudhakar says is that they are carrying out at least 1,500 tests in Karnataka, and out of that 10 to 12 people, now almost 20 people, 19 to be precise, have tested positive for COVID-19. So that being said, the measures need to be more stringent when it comes to spreading the halting the spread of COVID-19, especially at these cluster areas. If probably the district administration had taken these measures which it has taken today to shut down the factory altogether for the time being, it might be possible that the number of cases we are seeing today might have been quite less. Today we are seeing 9 new cases of COVID-19 being reported. Already patient number 52 is the first case coming in from this particular pharmaceutical factory, has recovered. He has been asked to put himself under home quarantine so that if any more further symptoms are to arise, then it can be kept in check, and that the virus, if at all still exists on this particular patient, it doesn't spread further. But that being said, there are several more primary and secondary contacts of these particular employees which has who have went on to test positive for COVID-19.